Hello, my name is Alexander Strobel, and I am going to be analyzing the dark mind of Hannibal Lecter from the movie Silence of the Lambs and discuss whether or not Lecter fits the description of someone suffering from antisocial personality disorder. Alright, and what is antisocial personality disorder? Antisocial personality disorder, or ASPD, is a maladaptive mental health condition characterized by an inherent lack of regard for the rights of others and a failure to conform to social norms. Individuals with ASPD lack a sense of remorse for their actions, react impulsively, manipulate others for personal gain, and often behave in reckless, violent ways. To meet the diagnostic criteria for ASPD, an individual must show evidence of a conduct disorder before the age of 15, be at least 18 years old, and exhibit at least 3 of the 7 symptoms listed in the DSM-5 text revision. And these would be the failure to conform to social norms, impulsivity, reckless disregard for safety, lack of remorse, deceitfulness, irritability, and consistent irresponsibility. All right, and here's the profile for Hannibal Lecter. He is 58 years old. He is a male. He is a Caucasian male. He used to be a psychiatrist, and he has been institutionalized due to cannibalism and murder. All right, and here is scene one. It displays his lack of remorse and disregard for others. And prior to meeting Lecter, there is Dr. Chilton, who is the head of the asylum. He he recounts an incident to Clarice that occurred in 1981. And while at the asylum, Lecter reported that he was experiencing extreme chest pains. So he was escorted to the building's dispensary for an EKG. And when they removed the mouthpiece and restraints to perform the EKG, he attacked the nurse, mutilating her face and eating her tongue, while his heartbeat never exceeded 85 beats a minute. So the medical team was able to reset her jaw and save one of her eyes. And this incident underscores the manipulative nature of Lecter, as he lied about his chest pains in order to incite violence. And in another scene, Lecter recounts a time where to Clarice of when he had dispatched a man, ate his liver, and ate it with a side of fava beans and Chianti. And Lecter's blatant disregard for others' lives, manipulation, and utter detachment from the brutality of his actions underscore some of the most common symptoms of those with ASPD.
Now, Dr. Chilton, but I'm going to show you why we insist on such precautions. On the afternoon of July 8, 1981, he complained of chest pains and was taken to the dispensary. His mouthpiece and restraints were removed for an EKG. When the nurse leaned over him, he did this to her. The doctors managed to reset her jaw, more or less, save one of her eyes. His pulse never got above 85, even when he ate her tongue.
Oh, Agent Starling, you think you can
Scene
die?
two.
A census taker once tried to test me. I ate his liver with some fava beans and a nice Chianti.
Alright, and here is scene two. So, throughout Lecter's initial interaction with Clarice, Lecter remains highly critical of her behavior and subtly asserts his dominance by exploiting his knowledge that she is a trainee at the FBI Academy. And when Clarice diverges from casual conversation about his drawings to asking more questions about the questionnaire she's brought him, Lecter immediately starts to criticize her approach, calling it ham-handed. And he reviews her earlier behavior, explaining to her that moments ago she had been courteous, receptive to courtesy, and had even established trust after relaying the embarrassing incident that happened between Clarice and Miggs, who is the cellmate in the room next to him. He begins to reprimand her, telling her that her novice transitions aren't going to work for him. And he also then begins to subtly insult her when he states that Jack Crawford, who is the head of the FBI's Behavioral Science Department, must be extremely desperate if he was going to send in a trainee to try and analyze him. So in this scene, Lecter is trying to establish psychological control and dominance over Clarice to undermine her confidence. And his manipulative behavior and his fight for psychological control is another core trait represented in antisocial personality disorder. Alright, and for scene three, manipulation for personal gain and entertainment. So in this other scene, Lecter attempts to exploit Clarice's hopes for advancement through the FBI for personal gain. In this scene, Lecter yells from his cell for the return of Clarice, who had just been assaulted by Miggs, and he seizes this opportunity. So he yelled for Clarice to return so that he could, quote unquote, apologize on behalf of Miggs. And after telling Clarice that he believes what Miggs had done to her, was disgustingly discourteous, he offers her a chance to advance her position in the FBI. So he tells her to go out and seek an old patient of his by the name of Moffat, or Miss Moffat, and suggests that there is valuable information pertaining to the investigation regarding Buffalo Bill to be gained by seeking out Miss Moffat. And his suggestion for Clarice to go visit Miss Moffat is one of the earliest instances of Lecter's psychological manipulation, and it serves as a key moment in establishing his control over Clarice. And after this incident, Clarice became somewhat reliant upon Lecter to collect information regarding the investigation of Buffalo Bill, which established Lecter as the most vital informant upon the case. This is another example of how Lecter manipulates others for personal gain and entertainment, which is a common feature among those suffering with ASPD.
And do this test for me.
No, but I will make you happy. I'll give you a chance for what you love most.
And what is that, Doc?
Advancement, of course. Listen carefully. Look deep within yourself, Clarice, darling. Go seek out Miss Moffat, an old patient of mine. Moffet. Go now. I don't think Mitch did manage again quite so soon, even though he is crazy.
All right, here are some of the theoretical perspectives. So for biological theorists, they would believe that antisocial personality disorder is often associated with abnormally low levels of serotonin. And abnormal levels of serotonin can impair emotional regulation, empathy, and impulse control. It may contribute to aggression and other key characteristics of ASPD, which can lead to problems or to the impairment of emotional regulation, empathy, aggression, and other issues related to ASPD. Those with ASPD have deficient functioning of the prefrontal cortex, anterior cingulate cortex, amygdala, hippocampus, and the temporal cortex. So, biological theorists would assert that Lecter's struggle with ASPD is rooted in the impaired functioning of these specific brain areas, compounded by the abnormally low serotonin levels, which adversely disrupts his ability to feel empathy, maintain impulse control, and regulate his emotions. Now, with the psychodynamic theorists, they would say that Lecter might be struggling to cope with early childhood trauma that may have disrupted his emotional development, leading him to become indifferent and cold. And in a study conducted by Dr. Emma McPhail and others, the higher an individual's ACEs score is, the higher the risk there will be of a diagnosis of antisocial personality disorder. It is likely due to the trauma Lecter experienced during his childhood that he may have begun to display signs of a conduct disorder during his teenage years. And he likely displayed this through running away from home, being truant in school, harming animals, and being destructive. Psychodynamic theorists would assume that the likely cause for Lecter's ASPD is rooted deep within unresolved childhood trauma, and Lecter may have had a rough childhood that may have hindered his ability to establish emotional grounding or form healthy attachments, contributing to his lack of empathy and his emotional detachment from others. And for the perspective of Hannibal Lecter himself, Lecter likely does not see his emotional detachment as an issue, like many struggling with ASPD. He likely views it as an asset that enhances his psychological superiority, which makes it easier for him to manipulate others. He rationalizes his actions to diminish the perceived horror of his actions, as he does not perceive them as wrong at all. His marked sense of detachment from his actions is seen by him as part of what makes him exceptionally better than others, and Lecter believes that his ability to commit acts that others whom he sees as inept and weak would never be able to accomplish themselves. And Lecter, throughout the movie, tends to frame his actions through a philosophical lens, which indicates that he feels that his actions are of brilliance rather than that of criminality or disorder. And Lecter's most prominent symptoms of ASPD. And based off of what we have observed, Lecter meets several of the requirements for a diagnosis of antisocial personality disorder, as displayed by his lack of remorse, his disregard for the rights of others, his aggression and violence, his deceitfulness, and his lack of responsibility, as he often trivializes his actions. And for the DSM-5 text revision, these are the symptoms that he displays. He displays all of them. We just don't have a history. From the movie, we do not have an established history of a conduct disorder, but it is very likely that he did suffer from conduct disorders when he was younger. Some possible treatments. Although treatments are available for individuals with antisocial personality disorder, it is very challenging to help those with this disorder. For treatments to work effectively, the patient must be aware of how his or her actions are impacting others as well as themselves. However, many individuals with ASPD do not believe that they need help or recognize their behaviors as problematic. Although treating this disorder is difficult, antipsychotic drugs such as risperidone and quetiapine have been found to help curb violent behaviors and aggression. And additionally, antidepressants and mood stabilizers can also help with some of the symptoms of ASPD. Medications are often coupled with psychotherapy, which seems to be the most effective way of managing symptoms. Now, does Lecter exhibit symptoms of ASPD? So, after thoroughly analyzing the film, it is fair to conclude that Lecter does fit the clinical profile of someone with antisocial personality disorder. However, it must be noted that the film does exaggerate the manifestation of these symptoms for dramatic effects. Individuals with ASPD do not typically express their disorder in such extreme or theatrical ways. It must also be noted that the film perpetuates the idea that individuals with ASPD are highly dangerous and calculative when it comes to violence, which is not the case. Additionally, there are several moments throughout the film, such as Lecter's disdain for discourtesy and his willingness to aid Clarice in the investigation, that conflict with our clinical understanding of individuals suffering with ASPD. It is important to remember that this film is a dramatization of the symptoms of ASPD. Hannibal Lecter is not representative of all those suffering from this disorder.